Hi guys and welcome back to Dillian Galla with Dr. Vanita Arora. So doctor, a lot of times we all focus on preemption of a heart attack. But what if you do, by God forbid, suffer a heart attack? What is the post-recovery step scenarios that one has to be mindful of? And even during the surgery, something that one or the family members need to be aware of.
So you're talking of after heart attack.
After heart attack, exactly.
So Adi, heart attack has to be treated in time. The first hour is the key to the treatment. The earlier you can reach the hospital, the better outcome you will get. But unfortunately, if you are not either able to reach because of whatever reasons, or your heart attack treatment gets delayed, which means you had a heart attack. We were not able to stop it in between by improving the blood supply to the heart. So that muscle of the heart, which was being compromised with the blood supply due to heart attack, that is gone.
Okay.
Once your muscle of the heart attack is compromised, you will have a fall in ejection fraction. Now, ejection fraction is the working of the heart as assessed by a very simple investigation known as 2D echo.
Okay.
The echocardiography assesses the heart function, the contractility of the heart.
Whether it's contracting properly.
Absolutely, and giving blood supply to the whole body, right? So this contraction, normal contraction, is 60%. Right? Now, if it falls down to less than 35%, which means almost half of the normal function, then these are the after heart attacks things. Right? Now, these patients will not have symptoms immediately, but they have to be followed up in the long term by a cardiac electrophysiologist who deals with heart failure patients, so that one, they do not lose their heart muscle further and they have a better quality and quantity of life.
So we have to avoid it being degenerated further than what it has. Is it a way to get it back to a full, like you said, 60% functionality or not?
If your heart function drops less than 35%, there are ways to improve it. First and foremost, there are certain medicines which have to be given, which improve the heart function, and you should follow the advice of your cardiologist or cardiac electrophysiologist diligently, because they are giving you these medicines to improve your heart function. Secondly, there are certain devices available to improve the heart function. Cardiac electrophysiologists are the people who pick up those patients out of the random of all. They have certain criteria. One is echo, the other is ECG, the third is the symptom analysis of the symptoms of the patient, to see that whether they can give a better outcome with these devices. I have a list of patients, I have been dealing with these patients for the last 20-25 years. I have a list of patients where the ejection fraction which dropped to 20-25%, we have been, with God's grace, been able to bring it back to 50%, 60%, totally normal.
Wonderful.
So these therapies are available in India with us, but you have to reach a right kind of person. You have to reach to the cardiac electrophysiologist to give you the right guidance. So patients, they actually get lost in the way. When they have a heart attack, they get a surgery done or they get an angioplasty done, and they think, they're going to live for eternity now. Everything is good, you got this done. But as you said, after heart attack, that is the key to being able to live a good quality as well as the good quantity of life till as long as you live. And quality of life is very important. More I deal with these patients, the more I see the heart failure patients would walk on a wheelchair, not walk, they will come on a wheelchair in my OPD. They'll be panting for breath. You stabilize them, give them a better thing, and you ask them what do they want, how good they want to live their life. Their answer is, डॉक्टर साहब, अगर मैं सांस चढ़े बिना अपने दिनचर्या के काम कर लूँ, थोड़ा अंदर बाहर चला जाऊँ, बाहर पार्क तक चला जाऊँ, I'll be good. This is what they are looking at, the quality of life.
Things right now.
Because when they present, they cannot even brush their teeth without getting out of breath. And then you have to, work at one thing at a time and improve their quality of life for better.
So, like doctor said, don't ignore your heart health. Don't ignore what your doctor tells you. Ask your cardiologist whether there are other possibilities and other cures available. We've been in conversation with Dr. Vanita. Stay tuned to Dil Diya Galla.